5 pounds in a day since I had 1 bite of food all day.
Well, where did you weigh yourself? Both times today on the scale?
Yes, this morning after I went to the bathroom, I weighed myself. And then just now.
I just can't get thin. Even when I take off weight, I'm still big. I want to be skinny.
The scale is going to determine your mood for the day?
No, that's why I'm getting rid of it.
I've been told that you can't fail with the surgery, so I'm sort of leaving myself open to that. Why did I choose this? Because I'm done. I don't have the fight in me anymore. I just know that I'm not happy now, and I think that this will help me to be happy.
Well, everyone agrees. When you gain weight, you lose self-confidence. On our show, Kelly Galvin, a 33-year-old single mother of 2, is taking the drastic step to lose the weight she feels is holding her back. She's having gastric bypass surgery, and the risks couldn't be any higher.
Okay. Hope you have an appetite.
Tonight's barbecue is the last time Kelly Galvin can fill her plate without thinking of the consequences. She's just days away from having gastric bypass surgery, and this is one of the last normal meals she'll ever have.
I don't know what the hell I'm going to do without goddamn coffee.
What do you mean coffee? You can't have coffee.
Well, you can only drink an ounce of fluid at a time.
After the surgery forever?
No. Like throughout the day, but...
Wait a minute, let's say a year from now.
I can eat food. I can eat, like, I will only eat a third of this or a quarter of this. I think they say 1.5 cups is what you'll be able to eat a year after the surgery.
Kelly's relationship to food will forever change. Tonight, she cherishes every last bite.
Someone hand me a hamburger? No bun.
Just the burger?
Mm-hmm. No, I don't want the mayonnaise.
What do you want?
I was going to have mayonnaise, but I'm good. You know, maybe I should.
It's open. You got a spoon in it. Oh.
Gastric bypass is major surgery. While some physicians suggest the risk for death is 1 in 200, recent studies argue that rate may be higher. And even when the surgery is successful, the risk for complications is high. For Kelly, it's a life-altering decision.
I think I'm nervous, I'm excited, but I'm scared. Yeah, I think that I'm just self-conscious about my weight. I don't want to be anymore. I don't know if I have a size that I want to be. I just want to look in the mirror and say I'm okay with what I'm seeing. Just to be okay and say I'm not fat anymore.
Kelly is a nurse who works part-time. She's also a single mother caring for her 2 young children, Andrew, 7, and Kendra, 13 months. The surgery is not only a gamble for her, but for her children as well.
I just want to make sure that I come home for the kids. That's my biggest concern. But I think that the big guy upstairs knows that nobody is going to take care of him like I do. So, I think he's going to keep me around.
It's okay, you can take it!
Yeah, thank you.
Go, Andrew, go!
I would do anything in the world that neither of my kids, so that they wouldn't be fat. There's nothing worse in this world than being a fat kid. Nothing worse in the world than being a fat adult, even. But for kids, I just think it's worse because it does keep you back from doing things. I have the baby on a diet. You know, I'm sure some child advocacy group wouldn't like to see this. I do. I water down whatever she gets. My son is so tall and thin that you can see the poor kid's bones. But her I am because she's just built differently than him. You do. You know, I have to make sure that she likes fruit and vegetables off the bat. You like the apples? Here's more. Here's more. Here's more. My sister's boyfriend likes to give her cookies. You know, so I yell at him, lay off the cookies, please. Give me a kiss. No, Pucker, come on. Thank you.
As devoted as Kelly is, her size is holding her back.
He gets mad that I won't go in the pool with him. He brought me out to bikini today. I'm like, listen, I am not even putting that thing on. He's like, Mommy, please, please, it's just us at the house. Nobody's home. You know, so I just got a t-shirt and I went in the pool with him. He was just thrilled. You know, and that day I felt bad. I'm like, what is wrong with me that I wouldn't even get in the pool? There was nobody at my house with my own kid. But that's just the way that I feel. I can't help the way that I feel. Last year, my son wanted me to be the class mom. He came home so excited. Wow, you want to be the class mom? Absolutely not. You are crazy. I didn't tell him that. I said, but no, we're not even doing that, just because I am not going to be up there and be the fattest mom in the class. There you go. Big smiles. Big smiles for mommy. I think that my full potential as a mother is being hindered because I can't be comfortable enough. Not that I don't do things with my children, because I do. I absolutely do. I would do anything for either one of them, but I think that I would just do more if I felt comfortable with me. I think that I would do more for them.
The gym hasn't paid off. The restrictive diets have failed. At 33 years old, Kelly now weighs 255 pounds. She feels she has tried everything to lose weight, and she sees surgery as her last chance.
You know, for the past 6 months, I've been at the gym 5 days a week, and I can only do 6 pounds. It was a mountain that I wasn't willing to climb. It wasn't difficult to make the decision to have surgery. I think what was difficult was coming to grips with the fact that you are 100 pounds overweight. I just got to the point that I'm done. Done fighting against the scale, done fighting against my body, done fighting against just the powers that be that say you are not going to lose weight. Something has to give. Something has got to change.
Yes? What are my pet signs?
Kelly lives on Long Island, New York, with her 2 children and her 2 sisters. The Galvin girls have struggled with their weight throughout their lives.
Kelly and I were always the chubbier ones. We were never thin. You know, I think certain people, that's just their body type.
She's always felt kind of not the same as everybody because of that, and she always felt, you know, not as pretty and not as important and not as, you know, popular. After spending 17 years, 17, 18, 20 years like that, it kind of takes a toll on you.
I think Kelly has a very poor body image of herself. I don't know why.
Susan's weight has fluctuated throughout her life, but unlike Kelly, she's more comfortable with her body.
We've both had this not problem, but issue, I guess you could call it, our whole lives. I've been a size 10, 12, and I've been size 22. I'm still me. When she told me she was gonna have the surgery, I guess I was kind of shocked. I thought it was pretty drastic, and I think I was kind of disappointed because it was like at that point that I perceived it to be like an obsession.
I don't believe anybody who says I don't care what I weigh. I'm okay at this weight. I don't believe that. I don't. I just don't. I know how society is. I know that I go to the mall and kids are calling me fat. You can't tell me that you feel great about yourself. I don't believe that. And I tell people that. I just see a big person. I know people say like, oh, you're a pretty girl, you have this, you have that. I don't see that. I just see the weight. When I have to get into the shower, I have to pass a mirror that I don't look at.
Up next, Kelly's leap of faith. Kelly is banking on gastric bypass surgery to change her life. But will this drastic procedure give her the confidence to conquer her insecurities? At 255 pounds, 33-year-old Kelly Galvin is more than 100 pounds overweight. In 2 days, she will undergo a risky gastric bypass operation as a last-ditch effort to lose weight.
I want to change the way I feel about myself, and I think that it will start with the weight loss. This is the jump start of getting a new me.
For Kelly, a single mother of 2 on a tight budget, it was a difficult and very personal decision.
I am finally doing something for myself. I used my income tax as a refund to pay for a lot of the consultations, and there was times where I felt guilty because I know that, you know, maybe I could buy Andrew boots or something, or I could be doing something more useful with the money, but that's my money, and it's being spent on me for the first time, and I couldn't tell you how many years.
Gastric bypass is an elective operation, and as a nurse, Kelly knows all too well the dangers of surgery. She has a series of appointments at her surgeon's office to review the procedure.
So what kind of medical problems do you have?
I'm an asthmatic, and I have pulmonary hypertension. I have some knee pain.
What kind of different things have you tried to lose weight?
I've tried everything. Gym, Weight Watchers, diet pills, liquid diets, the cabbage soup diet.
You've tried just about everything out
Yeah.
A lot of patients are going to say, well, I don't eat that much, and I did lots of exercise. The bottom line is, in order to be overweight, the calories that the patient's consuming must be greater than the calories that they are expelling. And people don't gain weight for no reason.
The first part of the operation is we divide the stomach. This used to be attached to this. we make a new tiny stomach pouch about 1 ounce the size of an egg. We then divide the small intestines lower down, and we hook up one end of the small intestine to this new stomach pouch. Now, the operation works for 3 different reasons. First, you have a very tiny stomach pouch, so if you eat too much, you may vomit. So you're not going to be able to eat much. And you're going to feel full and satisfied. You're not going to want to eat much as well. The second reason it works is you might get something called dumping syndrome. And what dumping syndrome is, you'll get crampy abdominal pain, diarrhea, if you eat any sweets. So this is going to help you avoid eating sweets.
I agree.
And the third reason the operation works is from here to here, all the way through here, there's no digestion taking place. You're not absorbing the calories from the food. It helps you lose weight.
Does it work? Can it not work?
We give no guarantees as far as surgery. Every operation has risks, benefits, alternatives. The biggest risk of the operation, as with most operations, is you can die from the surgery. And the risk we quote is 0.5%, which is 1 in 200.
The physical effects of surgery are serious, and to prepare for these changes, patients are referred to a psychologist for support before and after surgery.
The next sheet I want to talk to you about, surgery without counseling is potentially dangerous. This surgery entails so many changes from an emotional, psychological, and physical standpoint. So tell me, why do you want to lose weight?
Me and the scale are just in a big war.
Sure. Well, this disease is vicious.
And no matter what I do, the scale is winning. I don't want any weight-related issues to keep me from doing things with my kids. I want to be alive to see them grow very old.
Absolutely. So now, how much do you want to lose?
I don't really have a number. I think just physically when I feel comfortable.
Okay.
Because I think that for me to say, oh, 120, I think that at that point, let's say if you can never get to that, I think that I will feel like I failed. I just think that I have gone through enough, and this is an option that's there for me, and I really think that I'm ready. Something really loose, big, and comfortable to wear home from the hospital.
And those are tight as can be.
They're not tight. They're sweatpants. They're sweatpants.
Right, you had them on and they were tight.
I'm wearing them home.
Kelly is having her surgery done laparoscopically. It is a less invasive method that reduces recovery time and eliminates large incisions. Still, it is a dangerous procedure and an upsetting experience for the family.
He asked me, Mommy, what are they going to do to you when you have the surgery? I said, they're going to make Mommy's stomach smaller. And I don't think he fully understood it because he then just jumped to something different. He's just upset that I'm not going to be home with him for 2 days. And God willing, if everything goes right, it'll be 2 days. Do I love you? You love me? Give me a hug. You gonna be a good boy while I'm gone? You gonna call me every night? You'll pick me up on Thursday? Bring me flowers? I'm on my way to the hospital.
It's 6 a.m. and Kelly's older sister, Catherine, accompanies her for moral support. Any pre-surgery jitters are masked by anticipation.
I'm here for surgery, Kelly Galvin.
Okay, have a seat, they'll be ready.
Okay.
I think she's a little bit nervous. I think she's more nervous than she's letting on because, honestly, this is a life-altering surgery that she's having. I don't know if the gravity of what she's undergoing has hit her yet.
How you doing?
How are you?
All ready to get going?
Thank you.
Do you have any questions for me? Any last questions before we go in?
No, I don't think so. Death is my greatest fear. My biggest fear is death from anesthesia. And I'm afraid I'm not going to wake up. But I also believe that God knows that the kids need me. Nobody can give them what I give them.
Just oxygen. Next thing you know, it'll be all over. What's up? All right, I'll take a knife. I'm going to blow the belly up with carbon dioxide so we can see inside the belly. All right, you can turn the gas on, please. Take a stitch, please. And that right there is the liver, that red thing.
Dr. Garber inserts a laparoscope into Kelly's abdomen, a tiny camera that lets him see inside without making a large incision. Various instruments are also inserted and used to reduce the size of Kelly's stomach to a tiny pouch. This will limit how much she can safely eat.
All right, now we're going to put the stapler in, and we're going to cut across the stomach. And this instrument staples both sides of the stomach and then cuts in the middle. now the stomach is completely transected. This is a whole new stomach, is this little piece right here. Now we're going to divide the small intestines with the same kind of staple that we used to divide the stomach. Now we're going to hook up this piece of small intestine up to that piece with the clip on it, so that the digestive enzymes from the old stomach can go back in lower down. I'm going to make a hole on either side so we can staple the two pieces of small intestine together. All right, now we're going to pull these tubes out of the belly. And that's pretty much the operation. We're now going to close up the skin, and she's on her way to a new life.
Kelly's greatest fear was that she wouldn't wake up from the anesthesia. But after an hour and a half, the operation is finally over.
All right, Kelly, well done. You did great. Surgery went beautifully. All right, everything went beautifully. Okay? All right here. Everything went great. Just relax. Doing great. Doing wonderful. I'm going to bring you to the recovery room right now.
How are you? Don't cry. Why are you crying? You're in a lot of pain? Of course you're alive.
Kind of surprised that she was so emotional because Kelly puts up a very hard exterior and she doesn't really let you know that she's got feelings going on inside and she's got fears and things like that, and that just made it very real that she does, and it was a side to her that you rarely get to see.
Just take it easy. Go ahead, you guys. Of course we can. Are you hungry? Are you taking me out?
Hungry? We were talking about that the other night.
I'm in too much pain. I said food, please.
It's the last thing
Can you give it a damn?
More morphine, please. More. I just wanted to come see you before I left. All right. I don't know if I'm gonna make it back tonight before visiting hours are over, but I'll come tomorrow. Okay. All right.
See you in a bit.
All right. Feel better. Try to calm your breathing.
No.
For the next 24 hours, Kelly will be monitored carefully. All she can think about are her children.
I miss Andrew, Kendra. I'm nervous about being around the baby. I don't know if she's going to understand why Mommy can't pick her up. I know she's not going to understand. I don't want her feelings to be hurt. I just can't wait to be home in my own environment.
The next morning, Andrew is brought to visit his mom.
Andrew, sweetheart, what are you doing? Oh, baby, how are you?
Good.
Give me a kiss.
And I want you both to picture with you. So that you can remember me and Kendra.
I would never forget you, sweetie. You want to do both hands on there? Let me hook yours. Go slow. Go slow. Don't go too fast, Mommy. Can't go that fast, honey.
I know, not yet.
Oh. Hi, doctor.
Feeling okay?
I feel fabulous.
Great.
Little pain, but only when I move.
Okay, mostly on that left side.
Absolutely.
All right. I went down and looked at your upper GI series.
Okay.
Everything looked beautiful.
Good.
Perfect. Just as we hoped it would look.
Good.
Dr. Garber is pleased with Kelly's progress. After only 2 days in the hospital, she is allowed to return home.
I'm just so happy to go home.
Hi there. Look.
Kendra.
Hi, Mommy.
Hi, is that your baby? Yeah. Hi, sweetheart. Hello, lovely. That is my son.
Up next, Kelly reunites with her kids and starts her new life. But will her dream of being thin come true?
I woke up this morning, took painkillers around 6. I had a good night's sleep, slept all night. Took painkillers before I went to bed. I'm still feeling really tender.
At 33 years old and more than 100 pounds overweight, Kelly Galvin resorted to gastric bypass surgery as a last chance to lose weight. Kelly is home and faces the long road of recovery.
Everything hurts. It hurts to laugh, it hurts to talk, it hurts to cry, it hurts to sneeze, it hurts to blow my nose. Coughing, you'd rather die than freaking cough. Crushing the pills because I can't swallow them whole yet. They're putting them in applesauce just to disguise the taste. I still don't think that I would have done anything differently. I still think I would have made the same decision. Part of you feels like I've gotten nothing yet, you know, but it's coming. It'll be there.
Kelly is adjusting to her new tiny stomach and its physical limitations. She and her doctor will need to monitor her health to guard against any surgery-related illnesses for the rest of her life. Kelly sticks to a diet of liquid and soft foods for the first few weeks to avoid feeling sick.
Okay, so this is my 2-ounce medicine cup and my 40-gram protein shake that I try to pack as much protein into one drink as I can so I don't have to drink these shakes all day long. And I drink this every 15 to 20 minutes. So I'm sort of living by the clock right now to make sure that I get enough in. So, but it's not bad. It's peach and strawberry flavored. Yesterday I had meatloaf, and that was probably, I think, the only solid food that I had since I came home. And I had literally like 3/4 of this cup full of it. And I put it into, I measured it, and I chewed the life out of that meatloaf. I mean, I just chewed the life out of it because I just said, please, God, don't let it come up. I don't feel like I've lost any weight. I'll get on the scale today, God willing, at the doctor's office, and something will have happened. But I do understand that after surgery, your body swells, you hold on to your water, your body's trying to protect itself. You know, maybe if I see a result on the scale, then I'll say, all right. Other than that, I don't like feeling like junk. That's pretty much how I felt. Just because of the pain, I'm so not good with pain. So you gotta help me up. Hold on, get this.
It's been 1 week since Kelly's operation, and this afternoon, Kelly's younger sister, Susan, takes her to her first post-op appointment with Dr. Garber. It will be the first time she has stepped on a scale since surgery, and her emotions and expectations run high.
So today's 1 week since the big day.
Yep.
How you feel? What are your feelings about it?
I feel fatter than ever, number one. I'm feeling discouraged. I just want to see something. At least if I see that the scale has gone down some, I can say, okay, I can calm down, sort of.
I think you're becoming obsessed.
I think I was obsessed before the surgery. Now it's just gotten worse because, you know, you say to yourself, you've gone through such a drastic thing, it's a week. But you don't look at it like that when you want results. I'm just happy. These are good tears. And I don't get dramatic. I don't think I've ever cried for happiness. I feel like an ass. And I don't care. I don't care. I've been through enough.
255 is the starting point. We're down to 237. So that's 18 pounds. So that's a nice jump start.
Absolutely.
All right. You're still going to have some pain by that side. It's still normal. Important things you need to worry about right now are you got to do a lot of walking, right? Number 2 is stay in the mushy foods until we see you again, all right? In about 4 to 6 weeks, we're going to get you starting exercising and then to see the nutritionist. All right, great.
Thank you.
Right,
Thank you, doctor.
All right, bye-bye.
I have to go make my phone calls now. They're so goofy, but I know that like there's so many people waiting to hear, so I have to go make my phone calls.
Kelly is feeling stronger physically and losing approximately 7 pounds a week, but her body will transform faster than her self-image. Logically, Kelly knows she's losing weight, but recognizing the changes in her body is a work in progress.
The scale has always been an obsession of mine. Before the surgery, I would take water pills to make the numbers on the scale go down, logically knowing that I'm not doing anything except depleting my body of vital water, which you need, potassium, which you need, so I compensated for that by taking a potassium supplement. You know, so I did horrible things to myself for the sake of seeing the numbers go down.
And just 2 weeks after surgery, Kelly's worst fears are realized. She thinks she's actually gained some weight.
You know, it's gonna fluctuate. You're getting obsessed.
5 pounds in a day, Susan. I had 1 bite of food all day.
Well, where did you weigh yourself? Both times today on the scale?
Yes, this morning after I went to the bathroom, I weighed myself. And then just now.
Well, maybe I messed it up when I cleaned it. I washed it down. Maybe I messed it up.
Stop cleaning everything.
Forget about, you know what? It's only a number. Are your clothes feeling looser?
Yes.
Weight and age are only a number. I'd like to be less on both. But the scale is going to determine your mood for the day?
No, that's why I'm getting rid of it. Got on the scale earlier and it said that I had gained 5 pounds from this morning. So after arguing with my sister about it, because she thinks it's ridiculous to let a scale rule you like that, I got back on the scale, minus the jeans and the sweatshirt, and needless to say, the clothes weighed 5 pounds. So I ruined the rest of my evening for nothing. It's a horrible, horrible contraption. They should stop making them. The scale has got to get the hell out of my house.
Kelly's always been obsessed with her scale. Now she sees it's getting in the way of her progress, and she's getting rid of it once and for all.
I think that it will be freeing not to have the scale in the house.
Up next, Kelly's weight is coming off, but will she be able to shed her insecurities and emerge a new woman? It's been 1 month since Kelly Galvin had gastric bypass surgery. At a starting weight of 255, she has already dropped more than 30 pounds and recently threw out her scale.
I don't know how much weight I've lost at this point because I threw the scale out last week. I'm doing fine with that. You know, not a biggie. I'm in a 16. These pants are 16s, which are a little bit loose. You know, not incredibly loose, but you know, they're comfortable enough.
Kelly's starting to notice her weight loss, and as a result, she's feeling less inhibited. Before surgery, Kelly's son Andrew wanted her to be the class mom at his school, but Kelly said no. She hated her body and feared Andrew would be teased for having a fat mom.
Tell me what that letter is. Who's the class mom?
You! Yay! Yay, my baby!
You happy about that?
Yay!
Yeah? What do you think about mommy being the class mom?
It rocks!
I certainly am not as thin as I wish I was, but you know, at this point, what the hell?
I have to go to the PTA meetings. I have to encourage the other kids' parents in the class to join the PTA. I know that like they have parties and stuff, and around Christmas time they make gingerbread houses.
Now the bat.
A bat.
I don't think I have to be there until like December, at least in front of the class. I'm happy that Andrew's happy. You know, I think it's good that I'm going to be around. You know, I think that the teacher needs to know that you're involved, you know, and that you're willing to put your children first. And Andrew's thrilled about it. And that was really why I wanted to do it, to make him happy.
A scarecrow here.
You need to bring me that picture, honey, so I can see it.
While Kelly is making major strides with her appearance and attitude, post-op life isn't easy.
Okay, it's a basement. It's a place.
Kelly's new tiny stomach has its limits, and she is learning what foods she can tolerate. Despite her restricted diet, she still has to feed her kids.
If I could eat it, it would probably be like this, that I could eat of the chicken. Yesterday I got the pain at 2 teaspoonfuls. I know I couldn't possibly have been full because I hadn't eaten since that was 1:30 in the afternoon. I had breakfast at 5 in the morning. So I knew that I wasn't at all full, but the pain, it's an overwhelming, horrible pain that makes you feel sick to your stomach and you wish you could just lay down and die, and I just stopped eating. I can maybe only eat like an ounce of something before I start to feel sick. And I know that I should be eating more at this point because when I came home from the hospital, I could eat 2 ounces. I don't regret anything. It's more annoying than anything.
How you doing, Kelly?
Good, Dr.
How's
Garber.
everything?
2 days later, Kelly checks in with her surgeon, Dr. Garber. She wants to make sure the pain she's experiencing is normal.
So you been eating well?
A couple of times I get pain in here.
You have that tiny little baby stomach pouch. So when you eat too much, when it starts backing up into your esophagus, that's your lower chest, you're going to feel it sitting right there.
Yeah.
And that's a sign that you're full and you've eaten enough, and now let's put my fork down.
Okay, because that's what I've been doing.
Let it all pass. And then it passes by itself, right?
Yes.
Okay.
Yes.
All right. That's all that is. That's perfectly normal. And that's
And
part of the reason why the operation works, because you get that feeling, so you
Yeah.
stop eating.
And the only other time that I've gotten that, and it was twice that I recognized it without being full, was I ate too fast.
Exactly. It's going to also happen if you eat too fast or you don't chew your food well enough.
Okay.
Any belly pains?
Nope.
Great. And you lost 41 pounds altogether, 23 pounds since I last saw you a month ago, which is
that okay?
that's excellent. That's super. That's
what
duper.
I wanted to ask you. I didn't know if it was too slow.
No, that's amazing.
Okay.
So you're doing better than average right now.
Okay.
At this point, we're about 5.5 weeks out, so we'll start getting into an exercise program, working with a personal trainer.
Good.
So I'd recommend doing that. Exercise is very important. Right now, you're losing weight no matter what you do, but eventually exercise is going to make a very big difference.
I'm dying to go back to the
So
gym.
it's good
I
to
am
start
so
now.
done being home.
Great.
Kelly's clean bill of health is a major stepping stone. Before surgery, Kelly says she worked out excessively but was still unable to lose weight. Now she expects that to change.
How you doing, Kelly?
Good, how are you?
Nice to meet you.
You too.
Okay.
Kelly meets her new trainer, Courtney Trembone.
Lunch, I have a protein bar, and dinner, I try dinner, but it usually doesn't work, so I usually have like yogurt or another protein bar. I'm maybe taking in like 500 calories a day.
Okay, just start walking now. Good. Give this down. How many days a week are we racing?
How many what?
How many days a week?
Am I going to do this?
Yeah.
How many days a week do you work?
I work every day.
Okay, I'm done.
You got another few minutes.
Courtney will design a program of cardio and weight training to help Kelly burn fat and build muscle.
As we go along, we're going to add more and more components to each of these exercises to get more muscle involved, more muscle tone. Get another break, I'm going to do it one more time. All right.
Okay. Whew.
Kelly's a lot more peppy than most people I have, and a lot more into her workouts. A lot of times, people's first workouts, they're here and they really don't want to be here. With her, she's already got the motivation, so now it's just pushing her to that extra step to attain the goals that she wants. There might be a time we're pushing and pushing, where her body can't take it anymore, and we don't want her to pass out or have any major setbacks. So it's going to take a lot of communication between me and her.
Oh.
I'm very confident that she'll get to the weight she wants to be at. We'll walk around the track a few times, take a 5-minute cool down, we'll come down and stretch out.
Oh, God.
Kelly and Courtney arranged to meet 2 times a week. An additional 2 days a week, Kelly will work out on her own.
Today is my first day back to the gym.
Okay, I'll see you Saturday.
I worked out before, 2 hours a day, but I swear I'm going to die right now. I mean, just everything hurts. It's a good thing I don't have stairs in the house. Because my thigh, I just can't feel my thighs at all.
Now, 8 weeks since surgery, Kelly is finally starting to see her results.
I see the weight loss now when I look at myself. I can definitely see it now. More days than not, where before it took me a while. It took me 60 pounds to be able to see a difference. But that's okay. I'm all right with that.
Gastric bypass surgery is only a tool for losing weight, and being successful is a lifetime commitment. Kelly is required to check in with her surgeon and nutritionist to prevent against illness and malnutrition. Private therapy and support group meetings are also recommended.
Whenever you hear someone who underwent weight loss surgery, they'll never tell you it was easy. It's a hard road, and it takes motivation, compliance, dedication, support. Post-op patients know that from now on, they're post-op patients.
Before we get started, why don't you guys just introduce yourself to each other for those of you who don't know each other, and just say pre-op, post-op, and how much you've lost.
Lois, hi everybody. It's 22 weeks, and at last count, it was 94.5 pounds.
Thanks. I'm Kelly, and oh God, how many weeks is it? 10 weeks. 3 weeks ago, it was 60 pounds. Woo-hoo.
Today, Kelly meets with other post-op patients to share similar experiences and struggles.
Do you guys have any topics you want to focus on today?
Post-op, it's just like I come here and I expect not to have lost weight, just because that's what's happened in the past. And I do, but then, like I leave here and I'm like, okay, it's going to stop.
It takes so long. I mean, I still haven't caught up. I look in the mirror and of course I see what I see, but when I'm not face to face with it, you just still don't get it.
On some conscious level, you say, okay, I know. I can see it. I'm not stupid. You can see it, but then I don't know on what level it is and where it's coming from. Something clicks in and says, oh no, you're still that person. I didn't think I was a bad mother before, but I have more time to do other things with them because I'm not focusing on what looks like crap. I'm trying on 85 different things just to look decent enough to go out the door. And I'm not grouchy because of what the scale says. I feel more comfortable in me at this point. I'm hoping it gets better. I'm imagining it will. I'm imagining it will.
Up next, Kelly keeps dropping the pounds and heads to the salon for a dramatic makeover. The past few months have been a life-changing journey for Kelly Galvin.
This doesn't, and it's all too big. 95% of my clothes don't fit me. You know, so I'm going out with my girlfriends, and I went and bought myself a new outfit. These are the jeans. They were 12 from 1820, dark. Then I got this sweater. I probably would have never worn anything with fur before. I like pink, so I'm just gonna be different. You know, try new things. Accessories, belt, pink suede belt. Also pink, yes. Black boots, you know, because you have to have black. You have to go with the black boot. Got up at the crack of dawn. Gotta get ready to go to the city for my makeover. So I gotta go dry my hair because I don't want to be late.
Hey, Kelly.
Hi.
Hi, I'm Ross.
Kelly, nice to meet you too.
Kelly's first choice for a complete makeover is the exclusive John Barrett salon.
Well, I'm thinking we need to at least richen up the color you have.
Okay.
And I'd really like to do like a couple of highlights around your face, just to brighten up your face.
Okay.
And I think it'll make your eyes come out a lot more.
Okay.
All right, well, let's get started, huh?
Okay.
All right. This needs to stay on about a half hour, the beginning of the glamour.
Just if they can have a little bit, I don't know, maybe of an arch, something. Yeah, women need arch. Absolutely.
I will definitely go shorter, but from what you have. But I'm gonna also give you like some layers to just also shapen around your face and give you also like more movement and give like something very sexy because you have beautiful eyes. And we have to make those eyes like very obvious.
The 7-year-old is the one who doesn't want the short hair.
Okay, but he does know that you're gonna have.
Yes, I told. Yes,
Okay.
I said, Mommy's coming home with shorter hair. Yes, you can be sure of that.
I never liked going to get my hair done just because I just always felt that I was too fat to just sit there. The majority of my issues are self-imposed. You know, for a long time, I would say probably 2 years, I cut my own hair. I had Susan cut my hair. Just wash it and I would come out and she would trim it for me. It's gonna take me a minute to get used to losing 7 inches in one day. But I'm definitely happy with it.
It's a new year, new body, new hair, do it all. Just get it done with and start everything.
So you're ready for it?
I'm ready, yeah.
Close your eyes for me. I'm gonna give your eyes sort of a smoky look. Okay. And that draws the attention right to your eyes.
Okay, take a look.
All right. Oh, yeah, baby. Liz Taylor?
And the lipstick is very nice. So are the eyes. The hair is great.
You like
hair,
it?
I do. I do.
It's not too short.
The lipstick I obviously have.
Your eyes look beautiful.
After hours of pampering, Kelly surprises her family with her new look.
Look at Mom! It's a new woman! Woo! Oh my God. Look how short it is. You're not my mom! Yes, I am! You're an imposter! Yes, you are!
What do you think?
Very nice.
It looks really good.
Very, very nice.
Really good, yeah.
It looks great. So good.
It looks good. You like
So
a
good.
a new woman.
Yeah.
Look at Mommy.
Now it's good.
Are you guys ready to go out?
Yes, we've been waiting.
Okay, let's go.
It's been years since Kelly's had an evening out, and she's ready to have fun with her friends. To celebrate the past few months and Kelly's transformation, they head to Tio Pepe in Manhattan.
What's the toast for Kelly? That I'm so glad that she's finally done something for herself, because she's always doing for everybody else. But no matter what, we love you any which way you are.
I've never had sausage before, so I'm winging the sausage here. I'm just going to see what happens with it.
Probably a little bit.
Don't do it.
Come on, Kelly.
No, but I'm not.
No. Get on. No.
Oh,
Show that new body off. Let's go.
Yes.
Let's do this. Okay. I feel like an idiot. What do you got my circle? Hold on.
It's been 18 weeks since Kelly had gastric bypass surgery. At a starting weight of 255, she's down to 172, a total loss of 83 pounds. For Kelly, the benefits are paying off, and she's shedding many of the insecurities that hindered her. After waiting a year, Andrew will finally have his mother go to his school as a class mom.
It is a big deal that I'm doing it. There's no reason that I didn't. It was me that stopped me from doing it. I decided to do it this year because I knew that I was going to lose weight.
I would like to introduce you to our class parents, Johnny's mom, Mrs. Boss, and Andrew's mom, Mrs. Galvin, and they'll help you with anything you need.
Oh, I'm going to show you guys. Maria, watch here. Take this right on your house. So it's like snow.
Andrew was so excited that you were coming today. The first thing in the morning, he'd take his backpack off. It's like, you can't believe what my mother looks like. I said, what happened? She had her hair cut. She had her makeup done.
I really am very glad that I chose this year to be the class parent.
We're happy about that.
He just gets so excited when he sees me. I think that it's good that I'm doing this for him. I'm happy that I'm making him happy.
Your mommy's gonna try to make a window out of this candy, okay?
I'm happy that my mom came because I thought that she wasn't gonna be here today, but she was.
Here's Samantha.
And I love her inside because she's so kind and we had a lot of fun. I'd like to thank the class moms.
I still look at myself as being fat, but it doesn't consume me. I wasn't self-conscious about it going in today. You know, I didn't even give anything about my weight a second thought today.
So what happened after Mommy left school today?
The best part about this is knowing that I won't be that fat ever again.
So Joe D said he liked me?
Yeah.
I don't feel like things are hopeless anymore because for the first time in a long time, there's finally a light at the end of the tunnel. Were you happy that Mommy came to school today?
Yeah.
So was I.